Okay.
Can you try to enhance the image quality? We see a lot of metal and nothing of the bone.
Yeah, this is better than in most of the
wait. We can
because
better that.
because we have some carbon rings. So normally you have the rings in aluminium, so you won't see. You will see less. So it's not that bad. We always try to get a little bit of recurvation. This is okay for the joint movement then. So now we'll make a half pin on the proximal part. Kurz. Ja.
Ich halt.
Ja. Ja.
So this is an important step. You checked alignment in the lateral view, and you're just happy with the result. If you leave the foot just hanging, then the whole reduction would be gone. So you would have a recurvation after that. So it's important to tell the assistant, keep it that way and don't move.